Hi guys, I'm Kurt Jimwell Resuelo, a clinical clerk from the Cebu Institute of Medicine in the Philippines, and welcome back to my channel. So for this video, I'll be showing you how to do a chest tube insertion, from how to prep the patient and the step-by-step procedure in doing it. Chest tube insertion is an essential skill for hospital doctors dealing with certain pleural diseases to drain the pleural space of air, blood, chyle, pus, or other fluids. Indications include a pneumothorax, hemothorax, pneumohemothorax, subcutaneous emphysema in the chest wall of trauma patients, and empyema. So prepare yourselves. But just a short disclaimer, this is an at-home tutorial video, so I apologize ahead for the alternative materials I'm going to use, and please bear with me. So, are you ready now? Let's go. Equipment needed: sterile gloves and gown, a chest tube or an alternative, cut down set, glass bottle system with underwater seal, syringe with local anesthetic, Silk O with curved cutting needle, povidone iodine as antiseptic, sponge stick, Vaselinized gauze, a plaster, and a rib cage model. Prepare the anesthetic and the waste basket. Have the patient in a semi-upright position with the arm placed above the head. Using the sternal angle as a landmark, feel for the second rib and move downwards. Palpate and locate the fourth intercostal space in the anterior axillary line. Prep the skin over a wide area of the chest wall with povidone iodine. Remember to do it in an outward concentric motion. Prep the skin 3 times. We're inserting a tube inside. Sterility is a virtue. Finalize the site of incision. Drape the area with 4 towels, not with a single fenestrated sheet. Start with the side near the surgeon, cephalad, caudad, then the side away from the surgeon. Use towel clips to secure the drapes. Right now, I'm using paper clips as an alternative. Straighten out the sheets. At the 4th or 5th intercostal space along the anterior axillary line, infiltrate the skin with a local anesthetic and block the intercostal nerve branches. Make sure to infiltrate the pleura. Make a 2.5 to 3 cm long skin incision well into the subcutaneous tissue. Insertion site should be as close as possible to the upper border of the rib to minimize the risk of injury to the nerve and blood vessels that follow the lower border of each rib. Insert curved Mayo scissors or a curved Kelly clamp and cut or separate the tissues so as to create a tunnel or tract in the direction in which the tube is to be inserted. This tract should be directed posteriorly, cephalad, and medially so that the tube lies posteriorly in the paravertebral gutter. Continue developing this tract all the way into the pleura. Remove the scissors or clamp and explore the tract with a gloved finger from time to time to make sure the tract is going in the right direction. After the pleura has been entered, insert the gloved finger to explore for adherent lung. Further enlarge the opening in the pleura by inserting a large chyle clamp and spreading it. Select the tube to be used. Note the location of the holes and the distance of the proximal hole to the tips of the catheter. Measure the distance you want the tube to extend into the chest. If hemothorax is expected, it is advisable to clamp the very distal end of the tube to avoid making a mess. Grasp the tip of the tube with a long chyle clamp so that the long axis of the clamp is almost parallel to the long axis of the tube. Insert the tube into the chest using the large chyle clamp as a guide. Remove the large chyle clamp when the tube has reached the desired position in the chest. Palpate superiorly and inferiorly to ensure that the tube has entered the chest. Suture the tube to the skin using a horizontal mattress stitch. Pass the stitch around the tube to close the wound margins. Cut the needle and put it away to avoid puncture wounds. Tie the suture in place tight to the skin. Now wrap the ends in opposite directions around the tube to form a series of X's. Do at least 4 loops around the tube. Push the suture down to the skin edge before tying again to prevent slack from being incorporated to the suture. Assess the strength of the suture. Connect the tube to the underwater sealed chest drainage system. Care should be taken to do this step properly, as this may cause pneumothorax if the tube is disconnected from the underwater seal. Make some additional stitches for skin closure. Place Vaselinized gauze dressing around the tube and push it up against the wound margin to prevent air leak. Next, tube site can now be covered using 2 4x4 gauze. Create a slit in the center of the 2 gauzes and then place them 90 degrees relative to each other to prevent the gauze from sliding off the tube. Plaster the dressing in place. Remove the drapings. Lastly, Verify the position of the tube by taking a chest x-ray. All done! So that's it for today. I hope you learned a thing or two about chest tube insertion. If you like this video, please like it, share it with your friends, subscribe, comment down below if you want me to do any more videos like this, any more tutorials like this, and okay, so that's it. Thank you once again, and bye!